Hello and welcome to another edition of Let's Talk. I hope this has been a great week and a great weekend for all of you watching this. It is my pleasure to have so many of you around the world once again sitting and watching what my guests have to say. And today I have a very special guest that I'm deeply honored to have, and I bring him to you with great pleasure because he's a man of many talents. His name is Dr. Edward Usifo Asikhia. He is an African who lives in the United States and actually shuttles between the United States and Nigeria, where he was born and raised and where he continues to do a great deal of work. And because names, every African name has a meaning, I am going to be asking him to tell us what his name, Usifo, means. Because it just may be that he's living true to that name. I say that because he's a man who has a medical degree. He's a medical doctor, trained at the prestigious University of Ibadan Medical School, which is Nigeria's oldest, established by the British so many years ago. He also has a master's degree in health planning and another master's degree from Wales, where he trained in psychiatry. And then he came to the United States after that, and here in the United States he trained and got certified as an Applied Behavior Analyst. Dr. Asikhia, welcome to Let's Talk.
Thank you so much, Dr. Ohiro.
All right. First of all, it seems like you have been in school for much of your life.
Correct.
Is that part of the culture?
Well, one is part of the culture. Two, all the training program I had was in resonance, in sympathy with the needs in my country, Nigeria.
So first of all, tell us what your name means.
My native name is Usifo, which simply implies that no prophet is acceptable in so homeland. No matter how perfect you are, you must always find fault with you.
So what does that mean for you? Because it just seems to me that you have been doing a lot of work trying to make things better in your homeland. And even as you do that...
just trying to strive towards putting in my best to meet the needs of my people.
Right, even though you know, and this is actually biblical for those of us who read the Bible, when that Christ himself said that no prophet is acceptable in his homeland, then it will just seem to me that the things that you're doing, you're not doing because you expect credit.
Correct. My vision is to make sure that I touch people's lives, irrespective of people's opinion, because there is no way you can satisfy any person on earth. But the positive thing is that whatever soul I touch, I'll be rest satisfied, because I'll be pre-warned that there is no matter the level of hard work, people must find fault in what you're doing.
Indeed, and that actually reminds me of some of the work that you have done, because I recall that I knew you at the University of Ibadan, and that was, we're not going to tell the audience how long ago that was, because we don't want them to speculate on how old we are, but I recall actually seeing you a lot and spending some time at the University of Ibadan well over 30 years ago, indeed, well over 32 years ago. At the time you were in medical school at the University of Ibadan. And then after that, I recall that you worked at I think it was with the Nigeria Airports Authority, and then the Nigeria prisons. And it just seems like your career has gone in so many different directions. Can you tell us a little bit about that?
Yeah, when I left the University of Ibadan in 1985, precisely as a medical doctor, my first job was to work in the place where I did my NYSC, that's Nigeria Airports Authority, Benin City. Thereafter, the place I lived was very close to the prison
Right. Let me stop you for just 1 second. Please don't lose that train of thought, just because some people might not know what NYSC is. NYSC is the National Youth Service Corps, which every Nigerian university or polytechnic graduate or College of Education graduate is required to do. It's like a paramilitary service or community service for the nation for 1 year, and you get to live on a small stipend in a state other than yours, right?
Correct.
Okay. I did that too, many years ago. So please continue.
So after my youth service, during that period, I was living close to the prison, that's Nigerian prison in Oko. Then I saw the plight of prisoners out there. I started to change my career. I started to leave that place to provide services for prisoners who are on the extreme end of the criminal justice system equation. That was how I got into the prison service. And while I was there, I noticed a lot of prisoners that had some mental issues. I needed to resonate in sympathy with the needs of these people. That also prompted me to get into psychiatry. At the same time, there was the issue of, I looked at the system, the Nigerian system. We had problem with organization, we had problem with financing, and there was this issue of insurance. Before I got down to the United States of America, I used to hear of insurance services, which does not still exist in Nigeria today. So because of that, I also veered into doing my MBA in healthcare financing. Then I also did MHPM, that is Masters in Health Planning and Strategic Management. All that was finding a way to help the Nigerian system and organize the health sector better.
If I may ask you, what part of Nigeria are you from?
I'm from Edo State. I'm from Afuzi in Edo State.
Okay.
Nigeria.
You are a son of the soil, because that's what that's the Awa West and Awa East local government areas of Nigeria. That's Edo State North.
Awa East local government area.
Right. East and West, Edo State North. That's what the people are known for. A lot of education, a lot of schooling. So you are indeed a son of the soil, as they will say back home. But you did rise career-wise in the Nigerian prisons, and that was a time when the way in which mental health was approached. It's not that it's that much better in Nigeria now, but in the prison system, I am sure that it's even worse than it is in the general population. I am not sure that a great deal of attention is paid to the mental health care of people in Nigerian prisons. Am I wrong about that?
You're not wrong. I think one fundamental area that needed to be improved upon, it was when I left, as I time I left, was this issue of classification of the prisoners. If you look at the United Nations regulation, the charter, every prisoner is supposed to be classified on coming on board, so that we'll be able to separate those of them that have mental health issues, those that have developmental disabilities like Asperger's or autism. This thing is not done. So they are made to face the criminal justice system, particularly those that belong to only have developmental disabilities like autism. They don't have that cheer of mind to advocate for themselves and to defend themselves. So because this thing has not taken place in Nigeria, that is one point. The other reason for trying to work on the classification of prisoners is that to enable them to, the system to put up a kind of aftercare program and effective rehabilitation package that will address the needs of these people. Because after all, justice is not just to throw someone in jail, but to reform. So these people need to be reformed, and this system remains today in Nigeria. I have not actually visited the prison for quite some time now. I don't know what program they have. But this, if at all they have any package, it's still something that needed to be improved upon. Gladly to hear that at least the current Controller General of Nigeria. He's a very highly enlightened man. He is actually a PhD holder, and I look forward to having something good from the Controller General. Also, the current Deputy Controller General in charge of medical is an articulate lady who has also was trained abroad too. We do hope that the presence of these intellectuals will bring positive change to the development of prisons today.
Right. So, you know, it's interesting that you talked about developmental disabilities. My question was about mental health, and you talked about developmental disabilities as well, and the autism spectrum. And then you mentioned Asperger's. And I'm asking myself, is it possible then that there are many people in Nigerian prisons who are there, not so much because they're supposed to be there, but because they were, maybe their behaviors in the community were not quite understood, and they are in prison without care? That's for you.
Repeat it again. I didn't get.
Yeah, this is the question that I asked. You talked about developmental disabilities in response to my question. You mentioned the autism spectrum. You mentioned Asperger's. And with all of those disorders that you mentioned, and even with Asperger's, which may not seem to be very serious or very intense, the reality is that there is still some awkwardness in behavior. And I am wondering if in a society like Nigeria, at the time that you worked there in Nigerian prisons, or even now, could it have been, and could it still be, that there are people in Nigerian prisons who are there not so much because they are supposed to be there, but they're there because they didn't get the help that they needed in the community. Their behaviors were not very well understood.
Yes, that is from there. It's possible. And also because of the fact that they cannot advocate for themselves, and also the prison personnel, as well as even the police, they've not really had enough training, sensitization training to enable them to know exactly the kind of human beings they are dealing with when they meet this kind of people presenting in the public.
Right. So when you decided to veer from the practice of medicine, you know, as a primary care physician, into mental health to become a psychiatry specialist, you decided to go out of the country to do that.
Yeah, I did. I left Nigeria prison system and went to Cardiff for a training program. And I left Cardiff to Ireland University College Hospital in Galway, where I went for my residency in mental health. So while I was there, particularly in child, doing my child psychiatry, I noted a large number of kids that come around and present as patients, mental health patients, of course. We found out they have autism and they have a lot of developmental disabilities. And most of the time we prescribe a lot of medication and we almost turn them to vegetable. It's not an issue that can be dealt with just by mere medication. So I decided to get out to specialize in behavior analysis by running a program with University of North Texas. So there I now became board certified behavior analyst at doctoral level, and with my first specialty in verbal behavior. And that really opened my eye further to the fact that we have lots of kids out in Nigeria, my country, in fact in the African continent, that present. When I was at the University of Benin teaching at hospital, a lot of them used to present because I don't have knowledge so much about developmental disabilities. We were always writing medication, but these are not amenable to medication, any of the antipsychotic per se. So you could complement if the person has comorbidity, that is both mental health as well as developmental disability, which you always see. Then there are other areas, that is applied behavior analysis, which today is the only clearly approved and proved evidence-based management for children with developmental disabilities.
Right, and right, go ahead.
Yeah.
And then you went and established the International Training Center for Applied Behavior Analysis in Nigeria.
Yes.
But with a center with 3 centers in Nigeria and Ghana, one in Ghana.
One in Ghana, then one in Lagos, which is head office, one in Abuja, one in Ile-Ife, one in Port Harcourt.
Right. So do you find that in Nigeria now, let's just say in Africa, that there is increasing awareness of developmental disabilities?
Yes. I remember the first trip I made to Nigeria was in 2011. We went to Ghana to host a program that is an awareness program that was organized by Global Autism, an agency from America for which I'm one of the board members. So I got to Ghana, and a lot of agencies came from Nigeria along all countries in West Africa. Then for that conference, that was the first opening. Then I gave them a lecture and presented my paper on the need so far. Also, I noticed that looking at the BACB registry, there's no board certified behavior analyst in Nigeria. So the need to actually create that, apart from creating awareness among parents, family, local care providers, there was need for qualified manpower. And I left that training program and went to Nigeria to organize a series of workshops to train those that are the first line providers out there to improve the quality of services they are providing. But that was not really enough for me, because there was need for us to step into the global stage. Particularly when I go for the World Conference, the ABI conference, there was no Nigerian there, no African there. So it became imperative that something has to be done. And most of my colleagues come around and start asking me, "You are from Africa, what are you guys doing out there?" There was no board certified behavior analysts. There were no institutions training people in behavior analysis. So it became an arduous task for me to do. Right. So it just became a responsibility on me to make sure I do my best to bring this technology down to Africa.
Yeah, first of all, I actually need to commend you for that, because we both come from the continent of Africa, and it is difficult for people who've been here a long time who don't go there at all. It's difficult for them to really understand exactly what you're saying. It was just a few years ago, I was given a lecture at the Ghana College of Physicians and Surgeons in Accra, and I was talking about the emotional response to diagnosis and wellness, emotional response to diagnosis and how that impacts wellness. And I learned from that audience that that in Ghana, for example, there was 1 psychiatrist to 2 million people. And it's very difficult for people to understand that, but these are the realities. So it's commendable when someone like you actually says, for me, that's not going to be just an intellectual discussion. I have to put something into practice. And you've not just done that. You've put something in place in Nigeria and in all of those places where you're working there. And that's to be commended. But the question that I have for you, now that we know that there is increasing awareness, it's probably not going as fast as one would like it to be. Do you have support from the system, that is the Nigerian? We know that back in Africa, when we are talking about the system, we're actually referring to government, because they have to approve everything that you're doing. How much support do you get?
There is no support for me from Nigeria. That is the short story.
Wow. you are also the president of the Autism Society of West Africa.
Correct.
One would expect that with a position like that, you do have some clout to be able to push policy in Nigeria. I know that you probably don't want to say everything, but at least you can give us an idea of why you think there is no support for you in Nigeria.
If you recall, you look at Nigerian system or African system, the leadership of the various countries there, they are not interested so much in things like autism. The fundamental problem out there is across the board, the problem of self-organization, which is born out of human behavior. There is no cooperation, no sense of self-organization. They prefer to be ruled by the Western power. So no one wants to cooperate. Like each country, they are not cooperating. Even different agencies from different countries, they are not cooperating as well. In fact, even the Autism Society of West Africa, most of the agencies that came from different countries, they are not even financial members. And it's quite difficult to even run the organization. If there is no financial member, then how do we run? All they believe in that, they believe that someone will come from abroad, get some money from somewhere, from United Nations or World Bank or whatever, and come around and do 3 days conference and they go away. And 3 days conference is not enough at all. They wouldn't even train manpower and so on. They believe more in the ceremony than the doing.
Yeah, it also strikes me that there may also be an absence of some kind of consciousness as far as what the priorities of society should be. Because for policy to be set, there has to be an awareness that there is a social problem. Do you feel that the people in power in these African countries actually believe that what you and I see as social problems are indeed social problems? Do you think that they see that?
I think so, particularly if any of the top officers there has a child that belongs to this spectrum. That's at personal level. But generally, the government is not sensitive, the ministries are not sensitive to the needs of this huge population across Africa, West Africa in particular, and Nigeria specifically. So there has been a level of awareness since that Ghana conference. We've been able to mobilize families, parents that have children with disabilities, do a lot of conference and a lot of awareness, and during autism period they go out there and carry black card and so on. It ends there. It's more or less an annual ceremony.
Right. So
and a colleague of mine who has been very articulate, Mr. Oki Martins, who is also leading a local training agency in Nigeria, has tried his best. We've been able to bring the matter up to the level of a House of Representatives. It just died there. They tell stories and so on. When they come out with policy, there is no policy there. So what we are left with is that we wait for top-down planning may not work. If you can see exactly what is going on in Nigeria now, just leadership issue is the major issue now. Elections and so on and so forth, they can't get this organized. Talk less of really appreciating the problem on the ground and really assembling those that can come together to have it solved.
Yeah, and if you're talking about elections in Nigeria or in some other countries, Nigeria especially, the amount of money that is being spent on that election can do a lot more for the people.
It can't do a lot. But it's not so much about the money. First of all, let's have a sustainable plan, a package of plan to enable us take off. Even when they have a ministry and money is voted, and the person that is running that ministry is not even aware of what is really going on the ground, that money will go down the drain, knowing our own kind of culture, and knowing our own kind of history. So from my own perspective, what I think needed to be done basically is manpower development. It's very critical. Manpower development. No matter the story we say, who can we train? I believe in doing, not theory. For you to do, there must be people that want to provide those services. That is very critical. Now we have a number of problems, problem of diagnosis, problem of assessment, and problem of service provision on the long run. But this is not in place. That is why I set up ITC, International Training Center for Applied Behavior Analysis. Because I took permission from the board, tried to approach a number of universities in Nigeria, said the idea to them because my colleagues keep asking me annually when I go for conference, what are you guys doing? If you look at the picture, the spatial distribution of qualified people, nothing exists in Africa. We still continue to remain in darkness. But other countries like Australia, India, and so on, every country in the world is involved in developing their manpower. But the best way to do it is that you demonstrate it. That's why I have to go ahead to put up an agency out there. Not just an agency, a school, a demonstration agency, a residential facility that will provide wraparound services so that even when these people are being trained, they have a place to practice and be supervised and be given the right approach. My intention is to move this technology to Africa. I started from my country, Nigeria, and West African sub-region. Then I believe that if I'm able to part and replicate the applied behavior analysis technology, it will go a long way on the long run.
So what is ITC doing right now? What is it?
Right now, we set up ITC as International Training Center for Applied Behavior Analysis, approved by the BACB. So far, we are trying to train the first line of care provider, which is called RBT, Registered Behavior Technician, registrable by the BACB, and they can, with that registration and certification, they can even work in any part of the world. So far, we started early last year, we have been able to train about 100 registered behavior technicians. By so doing, we will be sure that at least the quality of services will actually resemble what the BACB board requires in terms of standard. And secondly, we also approved to train BACB, which none of the universities in Nigeria embrace. That is Board Certified Assistant Behavior Analyst. Right now, we have about 25 people, students for the training program, and we run it. We have a center in Ile-Ife, center in Port Harcourt, and the main center in Lagos. And we're actually headed towards Ghana now to start up with registered behavior technician training. That is the only way I feel I can make some contribution, and they are doing fine.
Wow, that is beautiful. And I just have, there are a bunch of questions that I could ask you. But I actually now just want to move from the larger system of government to a smaller system, which is the family system. So my question is, when you, as a behavior analyst, are working with people that have developmental disabilities, and in a culture like ours, the one where you and I were raised in Africa, where people don't really know a lot about these things, what do you think that parents whose children ought to be assessed or need to be assessed, what kinds of questions should they be asking? What should they ask for?
Yeah, right now, from the training, from my own experience in Nigeria, we discovered that parents don't seem to ask the relevant questions that will be of benefit to the child. I appreciate the fact that it's their children, but because of our perception, the thinking, the mindset of our people, they wouldn't supply the information that is required, that they need. They still rely on those things like here's my child, he has a problem, they want you to fix it, and they think of it like something like headache. You pay for it, then you just give them paracetamol, something like that, the medical model of thinking, that the child drinks it, then the child is well. That is the mental state they come with, which is not the case in terms of the developmental issue. That's number one. And two, when they come around, they are not involved at all. First thing is denial. They will not supply you with the information exactly what the problem the child has. You ask a parent, can your child write 1 to 10? Some of them are so ignorant they will not be able to provide that. They have to call the house girl or whoever is taking care to ask, can Mary write 1 to 10? Which is embarrassing.
Wow.
Two, they are more focused on diagnosis because they've heard a lot about autism. They want you to tell them that their child has autism. They will prefer to go to India, South Africa, they won't travel abroad, those of them that have money, just to be told that their child has autism or their child has intellectual disability. They are so fixated on that. If a psychologist tells you that the child has intellectual disability, maybe IQ is 30, beautiful. Then after that, what next? They should be asking about assessment, thorough assessment. In behavior analysis terms, they should ask for more assessment. The more they ask for assessment, the better. Then two, they want to know exactly what are the strengths of my child right now. What are the areas of skill deficit? They're not interested in that. And also because verbal issue is very prominent with children with autism. They're only concerned with my child cannot talk. But this is a child, the skill of talking span across a number of areas. It could be purely medical. It could just simply be because of autism or thereabout, with a neurodevelopmental issue. But there are other major areas which constitute about 80% of management this child needs. The child cannot toilet appropriately. The child cannot brush his or her teeth. The child cannot dress himself. The child cannot cross the road. The child cannot even cook. So a large number of activities of daily living, even if your child cannot talk and the child is able to make a sandwich and eat when he's hungry, the child can bathe him or herself, can dress, can cross the road, he can participate in activities of daily living and take care of himself. We've done about 80% of the problem. That one is, they don't care about that. The child just wants the child to talk. These are huge areas, so there is need for functional skill assessment alone that will provide kind of wrap around supportive services. They ignore that. And even when you tell them these are areas that are important, they are not interested in that. They just want Bobby to talk. And not just Mary to talk, they want Mary to talk within 3 days or 1 month. And if they are not getting that result, the child is taken away from you, they go elsewhere again and keep moving from one therapist to the other. That's a major area, either born out of ignorance or out of emotion, anxiety. But that will not solve it. And also, their active involvement in the management of the child, they don't see them having a role. Their role is to give the child to you, or hire a house girl that will be provided for all the needs of this child. That is all. How are you going to feel? If you ask a parent what is the problem on the child, you are asking detailed questions, they can't provide that because they don't spend time with the child. When we do send a therapist home to provide services, The optimal time the therapist may spend, maybe 3 hours in a day. They take 3 hours out of 12 active hours in a day. That belongs to the parent. So the parents need to get themselves involved to know exactly what to do when Bobby is presenting with some problems, that they're able to take care of that. After all, the child is living in the home. That is that child's home, and that is where they are likely going to present some problems. Then you've got to deal with that. But that is not the concept. The concept is cash and carry. I just buy it, and it's not my job. I'm going to work. I don't have time. But the problem remains after waiting for you where the therapist goes. It's not sustained. The management is not sustained. Because the principle behind the management is sustainability, repeatability over and over again.
Well, yeah, that is the case, but it also seems like a part of what you're describing is the magical thinking that people tend to have sometimes, which seems to be enhanced these days by the kind of religion that is being practiced and pushed in that part of the world that says problems can be fixed immediately, however big they are. So I'm wondering what you see as the role of religion in this. That is not to say that we're not religious. I am, and you definitely are. But does it not strike you, in a different way when you understand the scriptures to be one way, and then suddenly there's somewhat of a modern push, which is for as long as you continue to give all of the money that you have, and of course Nigerians have a lot of money, your problems, however big they are, can be solved immediately. So that mentality carries over with these parents who bring their children to you and expect you to solve the problem right away. And of course, before they come to you, sometimes, in nearly every case perhaps, they've been to those religious leaders as well to try to take this problem away. So doesn't this fit with that somehow?
Yeah, there are huge problems in terms of addressing these difficulties out there in Nigeria, for example. When I grew up, I got to know of Anglican, Catholics, and they came in with a lot of support, educational, even medical or otherwise. But recently we have the emergence of Pentecostal churches of different colors, and also there with our traditional belief system, and whatever transpires in your home is caused by the gods. We understand that quite often because we grew up with that notion, but we have actually evolved. But the one that bothers me is this advent of certain class of Pentecostal churches that assemble these kids that could be autistic or Asperger's and so on, and bring them out and say they are witch. And the moment you tell the parent that your child is a witch, that is why she cannot talk. Your child is a witch. That is why she's talking while she's sleeping. Your child is a witch simply because he looks at you and just start, toileting where he is. And they feel frustrated and they buy into that. And then you see people trying to either beat the children, pour hot water on them, abandoning them, and so on. That's a very retrogressive approach again, and that is causing me some concern in some part of Nigeria.
Yeah, I have actually seen videos of children being battered and mutilated by preachers who accused them of witchcraft. And that seems to be the kind of thing that you are describing. So it does appear then that there needs to be a remarkable change in the mindset of our people, even the very educated ones, if the kinds of change that you seek are going to actually happen. That there will have to be a change in the mindset of the people.
Correct. And one way we are trying to approach that is this awareness issue from state to state. Particularly, it's more prominent during Autism Week. And we still need more because we don't have the support of the press, radio, television to highlight all these things. And also we need a policy. And some of these situations where the children appear to be abused because of the very unfortunate situation they find themselves. Even the police are supposed to come in, but they need sensitization training, which is not available to the police. Even social workers out there, teachers, even the judges, when the police arrest someone who could be asparagus and they bring the person to the court, cannot advocate for himself, then he's taken to prison.
You know, several weeks ago I had here Professor Oni-Eseleh. I believe you saw that show. Professor
Yes.
Oni-Eseleh, yes. He's one of the most respected sociologists in this country.
Correct.
And he also was born and raised in Nigeria, just like you and I. And one of the things that he said, he described some of what you're describing now. He described them very extensively, because what I wanted him to do was to take a sociological perspective and just diagnose and dissect Africa, today's Africa. And he talked about what he described as an absence of a collective conscience now. And so it does appear that, listening to you, we all have a role to play.
Right.
It used to be that we were all we were all our brothers' keepers. That's the way it was. Now the society has become much more individualistic as everyone wants to get rich. So the question that I have for you now is, if you can't get the support of government, it's not that you'll never get it, but it takes a lot to get that, a lot of bribery, a lot of hopes, depending on what country you are in. Yeah, because that's, in some countries in Africa are definitely better than others. How do you think that the rest of us, the regular people, can be of support to your efforts?
Well, it's like what you're doing right now. You're trying to bring my word out there to reach out to the people, those who don't know me, those who don't know of the activities going on. Those of us here who keep complaining that Nigeria is there having a lot of problems, things are not being done about it. But where I put the government and they are not making me giving any support, I take it upon myself. I'm using this medium to appeal to Nigerians, colleagues out there who have heard this story, to rally around with me and all other behavior analysts that exist in Nigeria to really forge ahead.
I have a two personal questions in the same vein. One of them is that I know that your wife is a special education specialist. Is she involved in this, and does it help that she understands these things?
Yes. When my wife was in Nigeria, she trained as a general educationist. By the time she came to join me in Ireland, she had a training in special need education and also have a master's in rehabilitation and disability management. And I also wrote the exam in America and became board certified behavior analyst. Right now, she is the person actively managing the project in Nigeria.
Beautiful.
Yeah, and right there we have a school. The school is not just an international one. We have a school from kindergarten to elementary, then to JS1, 2, 3. And JS1 to 3 is meant for children with disabilities. Kind of get them in, because a number of them are attending schools quite okay. But after primary 6, where are they going to get into? There's a kind of technical package for them to absorb them and train them in art of rehabilitation. That's number one. Before we'll have the BC ABA program approved for by the world body, which is of university level, and we also train RBT. Then we also went ahead to set up a residential facility because we discovered that so many parents don't have time for their children. People come from Port Harcourt, from Abuja. Those who cannot provide effective management for these kids. We believe that they need wrap around service package. They can come over there, get to know the school. It's an inclusive school, of course. No, have the normal training in the school, have the educational intervention part of it. Then when during closing and after closing, they get back home and go into the residential package of it, where we have to train them on activities of daily living. Then we also add the behavior intervention on top of it. We take them out, she takes them out on a regular basis into the community for community integration. They should be able to go to shop for shopping, you know, to identify bank, you know, to identify, should be able to go to party, they should be able to go to the stadium, they should be able to go to swimming pool and actually participate and go to post office or post letters. These are part of them. We want to get them involved into the community. Let them know that they are part of the community. Also take them to churches, depending on their denomination, to participate in church. After all, they are also entitled to salvation.
I have another personal question. I haven't seen you. I mean, we haven't seen one another in at least 30 years. It's been over 30, about 30 years, over, a little over. So thank God for technology. And now I cannot say tomorrow that I haven't seen you in that long. And so in the time that we haven't seen one another, you have actually raised a family, and one of your daughters, your daughter is a medical doctor. And I am just wondering if she shares your vision.
Yes. All my children, they share my vision. And my first son is a psychologist. He's also running right now in an organization with providing services for developmental disabilities. My daughter is a resident psychiatrist. He's also running up her BA program as a board certified behavior analyst to provide service to children with developmental disabilities. So for almost all my kids, they belong to medical sector, and they have the primary level of RBT, registered behavior technician. So technically, maybe it's now a family issue, desire to go home. They've been home to see the facility, what we are doing there, and even participate in, providing service to these children. So that is where we are. And right now we are building a new facility, because there is an issue of accommodation out there in Nigeria. We are building a permanent site in Lekki area. And they try to supervise, they go in there once in a while to go and supervise what is going on.
Beautiful. Yeah, I asked us.
I like to share an experience with you. As well, we are trying to find out a place for residential facility. We had cash in hand. It took my wife, who is the program director there, to get a house. More than 7 months. The moment they hear that the children, the people that will be there will be children with developmental disabilities, they will refuse to give that house out for rent. Even though we don't call it, it's not a hostel, it's a home, because my wife lives directly in the midst of these children. My children are grown. She is at the same dining table with them. That is their home. And right now, like rightly said, my children are grown. I don't have any to worry about, but I do have a lot to worry about out there. I still have a lot of children. I see those that are receiving services from my agency as my own children. I owe Nigeria a responsibility, and I owe these kids a responsibility.
Wow.
I am there to advocate. I will do my best, and I do believe that if I continue with this and help to develop manpower, the other people will take off from there. I cannot do it alone anyway, because I believe in teamwork.
Right.
Getting the teachers, psychologists, psychotherapists. Like I mentioned, I've already trained about 100 people for RBT. I am glad to mention that even some university professors came for that training, some psychiatrists came for that training, psychologists came for that training, and a host of others. Well, that is my desire. But I have a peace of mind when I see someone I manage that who cannot talk and is talking. That is the grace of God. I feel fulfilled with the little I'm contributing.
Right. And the reason I asked those personal questions was because you talked about the lack of and the need for enduring manpower in Nigeria. And now I think you really have nothing to worry about when you have trained generations of people, even in your own family, to really understand, know, and believe in your vision and are part of it. So you really don't have anything to worry about because the rest of Nigeria and the rest of Africa will get it. It does take time, really. It does take time, and you are traveling the road in a way that I am really, really very proud of, because in many years ago, none of us would have thought that we would be doing the things that we're doing. But I think that I definitely would not have thought that you, that your medical profession will veer in this direction. But if one looks back now, one can just see how your heart for people, your passion for community was leading you all along into to this direction, and it just really works very well. And I wonder if you have any final comments before we part.
I just like to thank you for the job you are doing. It's also part of teamwork, because I can't do it alone. Like I said, my family can't do it alone. This is your own bit of the whole thing. Get the story out there. I'm sure the government will hear from you, or hear from some other person, or an important government official might have cause to listen to this interview. Then they will step up. But basically, the message I have is that, one, manpower development is a fundamental issue required in Nigeria today. Maybe as I mentioned before, right now we have so many institutions worldwide that are running this training program. International Training Center for Applied Behavior Analyst is the only institution in Africa that exists. That's number one. And I'm still trying to push some Nigerian universities to come on board. That will help a lot. And also, I will appeal to the government to step in when there's a need for governmental support. Because what I'm doing right now is supposed to be government responsibility. I do not have any funding anywhere. And the worst part of it is that even where we have some funding, international funding, because of Nigerian reputation. If you apply for that funding, you say you are from Nigeria. In fact, most funding opportunities don't even have room for it because of our past history. That may just setback. And I will appeal to parents too, to be hopeful. There is hope. I understand the plight they are going through. Quite difficult, very traumatic. But there is hope.
Thank you very much, Dr. Asikhia. I have been honored, and I actually feel glad that many people are going to watch this. And so, Dr. Asikhia, I really, really just want to thank you for coming to spend the evening with so many people. I am the one that people see on the camera, but it is actually so many people who are watching, who I will be hearing from. And I am going to put up your website so that people can visit and see what you're doing. And I really like to thank you for the time that you've spent here, and I know that many people have benefited from it, and you will be hearing from people, including me. So I thank you very much, and my regards to your family. And
thank you so much.
Right, and I know that your wife and children are very proud of you, as you are of them. And those of us who know you are also very proud of you. I really didn't know all of these things that you have shared today. And I knew you were doing great work, but I didn't know it was this much. So I thank you for what you're doing for the community back home. And I hope that it is really not the clothes that we wear or the cars that we drive, but it is what we do in the world with the talents that we're blessed with. And I am very glad that you're using your talents very well. And so you are honored, my man, and God bless you. And thank you very much for being here.
Thank you.
All right.
Thank you so much, Dr. Hero. Thank you.
You're very welcome. Bye-bye.
Thank you for having me.
You're welcome. It's my pleasure.